Okay, I'm here with Dr. Adams, and Dr. Adams is a retired dentist, and he is here for some hair today. Dr. Adams, how you feeling this morning?
I feel great, and I feel very confident.
Excellent.
That what I'm going to have done today is going to fill my needs. I practiced for 50 years in cosmetic and implant dentistry, and over those 50 years I've had a progressive loss of my hair. And recently I decided that I wasn't going to continue to have this comb over, and when the wind blew that I would see these bald spots. So I decided that I would do some research. I have a lot of professional friends and I'm quite familiar with the procedures. And now that I'm down here in Florida, I came upon this fine young hair transplant surgeon, Matt, who has really impressed me with his techniques and his procedures. And after quite a bit of research with other professionals and speaking to some friends over here at the Holy Cross Hospital, they highly recommended him because of his techniques and his artistic ability. And so we're about to undergo the procedure, and I look forward to a wonderful result.
Excellent. Wow, well spoken. Well, way more than I would have said. Unbelievable. So you feel comfortable with the surroundings, the office?
Absolutely.
Staff? Okay.
The office, I'm quite familiar with professional offices.
Yes.
The office is laid out very well, very clean, very crisp, very neat, and the assistants and those professionals that Dr. Hubert has surrounded himself with seem to be of the highest caliber.
Okay.
So I'm quite confident in undergoing this procedure.
Well, excellent, and thank you very much, and we'll be checking in with you throughout the surgery, and thanks for helping other people out as they do their research. Appreciate it. Okay, here with Dr. Adams. I just wanted to show everyone his new hairline. So we've drawn out where his hairline's going to be, and we're getting pretty aggressive with his hairline, but I think he's gonna totally pull it off. He has great hair. It's going to look very natural. He has enough of a forehead, and you can see where we actually built in some natural recessions on either side, so it's not just completely straight line. And I'll put some pictures in here as well. So we shaved the area in the back, and he's ready to go. And he's not even going to take Valium today. He decided that he's going to just be completely awake the whole time, and that's completely fine. I'd say about half of our patients take Valium and half don't. So, Dr. Adams, you excited about getting some hair?
Yes. In fact, I'm very impressed with the cooperation between the patient and the provider in determining the hairstyle and where the hairline is to be. You have complete cooperation. Your input is encouraged by the doctor to see that you're totally satisfied with the end result. And
having one patient a day, we can take as much time as necessary.
Absolutely.
The first question I ask everyone is, where do you want your hairline? What do you think? And because people always have things in their head that they know. So, and I advise them, as long as it doesn't look unnatural, we'll help you get your goals. So thanks again. We'll be checking in a little later. Okay, I'm here with Dr. Adams, and at this point in the procedure, his strip has been harvested, he's been sutured up in the back, and at this time, we let people walk around and, use the restroom, stretch their legs, and that's what he's doing. Dr. Adams, how's your day going so far?
Well, actually, I have to say, after treating tens of thousands of patients and being on the other side of the needle, so to speak, the syringe, it was totally atraumatic.
Excellent.
It was very professional. I mean, there was no pain. I was totally relaxed, and everything was done in the utmost professional manner. Sterility and concentration. They spoke to any needs or questions that I had. Excellent. I would say that I made a very outstanding choice in being here with the doctor, and he had assistants here, all professional.
Excellent.
Very professional.
Thanks for the kind words.
Okay.
But more importantly, we want to see your results. So I can't wait till you come back in a couple months and do that. But actually, you said no pain right now.
Absolutely no pain.
And
not even in the initial injections. I would say I couldn't have done a better job.
Excellent.
Myself and Dr. Hubert, and his all his professional people that surround him do an excellent job. And I would say from one professional to another that I am very happy that I made this choice.
Excellent. Well, thanks again. And we'll be checking in a little bit later. And just so you know, guys, he hasn't had any Valium, any sort of medication, a sedative, anything. Is completely alert, pain-free, watching some television. So we'll check in him a little bit later, but thanks again.
Okay.
Okay, back here with Dr. Adams, and at this point in the procedure, the strip's been taken out. He's been sutured in the back. That strip has been cut into many pieces, little grafts, and all the little slit sites on top of the head have been made. So we designed his hairline and gotten back a little past into his crown. So he hasn't had the actual grafts placed in the slits, and that's the next phase. But overall, Dr. Adams, how are you feeling?
I would say that I would consider this phase 2 in the procedure totally asymptomatic, no pain at all.
Yeah.
You would not, there's nothing to fear in this. Dr. Huebner is doing an excellent job, and he has his assistant with him, and it's just going as smooth that you wouldn't, highly have no fear in this procedure as far as pain is concerned.
Right.
It's going very smooth, and I'm very satisfied.
Excellent. Yeah, you've been watching TV. We've been talking about
different things.
Talking
about the procedure.
Yep.
And it's, as I said, there is no pain at all.
Yep.
And the suture, it went fine. The donor site, it's all going fine.
Excellent. I'm gonna pan up here and show the little sites that we made. So
make the little sites.
Yeah. So
where the graft is going to go.
And I hope camera picks it up. Now you can see that he has a new hairline with these slits, and I'll try to take some pictures. I might show it better. But we've actually kept his hair. He didn't have to shave. And then we always say it's not mandatory to shave. But you can see that there's a bunch of little tiny sites everywhere. And, very little bleeding. A little oozing, but that's to be expected when you make thousands of holes in someone's head.
No bleeding.
A couple little drops of blood here and there, but nothing bad.
I would be... if there were no bleeding, then I would have some worries.
Well, there'd be a problem if there was no bleeding. Then how the graft's going to survive with no blood supply. So, at any point, he's going to actually, we just ordered Italian food, so he's going to go eat. We're going to eat, take a couple minutes, take a break, and then we'll go to the next phase. So we'll check in on you in the next phase. Okay. And thanks again, Dr. Adams.
You're quite welcome.
Okay, I'm here with Dr. Adams, and we have just completed his surgery at this point. Dr. Adams, how was your day? How do you feel? I guess you're ready to get out of here and get home, but overall, how was your day?
Well, let me say this. This is the final phase here. We've completed the procedure now. And I have to say it's been totally painless. So if there's anybody out there that's afraid because they think they're going to experience a lot of pain, forget it. It was totally painless. I spent a lot of time researching the qualifications of Dr. Huebner. He's 50 years practicing oral surgery, implant dentistry. I've been on the other end of that needle, so to speak. I would say that everything went smooth, very professional. I've researched this particular doctor, spent a lot of time on a professional level about his qualifications. I know that you can go on the internet and you can see all these different transplant physicians, and they'll show you pictures. And I know for the layman, sometimes it's hard to make a decision. But I would say, see Dr. Matt Huebner, because I think that he is going to give you a service that you will not regret, and you'll be very happy with the final result.
Excellent. Thank you for the kind words. I'm going to come up and zoom in here, and again, I'll put some pictures on there. So right now, as I tell everyone, you look like Frankenstein when you leave, but that will only be a temporary thing. And you can see where his new hairline's going to be and how that's going to reframe his face nicely. And you can see how staggered, meaning that it's not a straight line, it's up and down, up and down. You can see that he has a little bit of post-op oozing, which is very normal. When you make 1,000 holes on the head or more, you're going to get a couple ones that will just ooze a little bit. That will all stop oozing within the next 24 hours. And you can see how far back we got. So we got clear back to his crown, even into his crown a little bit. And we maintain the hair that he had. So he's going to be able to sort of take that hair forward or from the side and temporarily disguise what's happened. And then in 2 weeks, all these scabs will be off and we'll be back in business, back to normal. So really looking forward to it, Dr. Adams, and thank
Yes.
you again for your testimony on our practice.
Well, it was what you earned it.
Thank you, sir.
Worth it. I've been very satisfied with the end result.
Excellent. And the end result is still to come. And again, we will be following him all along the way. So thanks again.